My name is Dr. Dennis McCluskey. I'm a medical director for Buckeye Community Health Plan. And the purpose of our little webinar here is to talk to you about Health Check, which is Ohio's EPSDT services. That's a lot of alphabet words here, so let's break that down. That stands for the Early and Periodic Screening, Diagnosis, and Treatment. This is a program that is mandated by the federal government through as a result of the amendment of the Social Security Act, and it actually dates back into the 60s. And whoever decided to do this was really thinking forward, because what these letters stand for is early. Identify problems early, starting right at birth. Periodic. Check children's health at periodic age-appropriate intervals. Screening. Perform physical, mental, developmental, dental, hearing, vision, and other screening tests as to detect potential problems. Diagnosis. Perform diagnostic tests following when we identify the risks through the screening. Not only do we diagnose, we want to treat the problems that we found, and that stands for EPSDT. As I said, the federal law requires that Medicaid cover a very comprehensive set of benefits and services for children up to the age of under 21. Some are not even available to adults. The federal requirements for early and periodic screening, they must be covered at an established periodic intervals and whenever a problem is suspected. So even at a sick visit, you can have the ability to find, this is a little suspicious. I need to now do a screening, I need to do diagnosis, and then I need to set up a treatment plan. So this includes comprehensive health and developmental history, an unclothed physical exam, appropriate immunizations, laboratory tests, as well as health education. The federal requirements also requiring the diagnosis and treatment, that diagnostic services provide coverage for further evaluation when a screening exam indicates a need. Treatment services are provided medically necessary treatment and other measures to correct or ameliorate defects, as well as physical, mental illnesses, and conditions that may be discovered by screening services. Health Check is Ohio's Medicaid name for EPSDT, and I think Health Check is a lot easier to say than EPSDT. Okay, so Health Check includes screening services, and for these screening services we follow the American Academy of Pediatric recommendations for preventive health. Any medically necessary screening, diagnostic, and treatment services, and these may go beyond the benefit coverage and limitations. Health screening frequency. In the first year of life, there are 9 health check exams that are recommended in the first 15 months of life, including 2 in the first week of life. Exams at 18 months, 24, and 30 months follow. Annual exam for ages 3 to 21. Health check screening exams. The components of this for a well-child visit are very, very comprehensive. Comprehensive health and development, comprehensive unclothed exam, health education counseling, anticipatory guidance, risk factor interventions, development screening, immunization screening, nutritional, very important this day and age as we see the obesity epidemic grow, vision and hearing screening, dental screening, and appropriate lab tests. The comprehensive health and developmental history include physical and mental health development. We all know how important it is when we have families at risk to make sure that the mental health is not being compromised by bad situations, physical health by lack of nutrition, family and individual history, current complaints, medications, allergies, and as very important, the social and physical environment and how it impacts health. When we get to the adolescent age group, we must ask about sexuality, contraception, drug, alcohol abuse, all these things that are unfortunately forefront and center. The comprehensive exam includes a height and weight and the percentiles. In the younger years, they had circumference when appropriate. Blood pressure, a big problem that's becoming more and more prominent. Examination of the head, eyes, ears, nose, throat. Respiratory, cardiovascular, listening for those unfound murmurs. Gastrointestinal, reproductive, musculoskeletal, and even the soft neurological symptoms. And remember, a sick child visit is a good opportunity to complete a health check exam. Health education, counseling, anticipatory guidance, risk factor interventions. These are required components of each health check visit. And I think that most of us do that. And I want to just talk here about it's not just the caregiver who's going to do some of this counseling and anticipatory guidance. The nurse who is doing, or the medical assistant who's doing the intake, who's putting them in the room, ask those questions of concern on how is the baby developing, do you have any concerns. Even your check-in people, even the person who's taking that appointment on the phone, well, how's your child doing? Oh, you can kind of be nice and make sure that they're comfortable talking to you. We want to assist the parent individuals in understanding what to expect in terms of their development. So ask them leading questions. Is the baby doing this? Is your child doing this? And provide information written that talks about the benefits of healthy lifestyle practices and disease prevention. Developmental screening, age-appropriate developmental screening is appropriate, and very important is the screening of motor, speech, social development, mental and behavioral activity. Notice if that child is making eye contact. Notice if that child will answer to the goo goo gaga, or how old are you? You're so big. And try to interact with that child to see, does the child shy away from you? Does the child get too friendly with you and come up and maybe need to say, whoa, this child has no barriers? Or just kind of get an idea about that behavioral and mental health. Immunization screening, required at every visit. I think with the electronic medical record of today, there are pop-ups that make sure that we ask. We also have stopped when children go to school, be it preschool. The schools are supposed to do their, are you immunized, and have the records in doing that. So that's important for immunization. Now here's an area that maybe we don't have the best of training, but we need to start asking about nutritional screening. We want to talk about what are dietary practices. What do you feed? What's a typical breakfast for your kid? Do you eat before you go to school? What's your breakfast like? What do you take? Do you take your lunch to school? What do you put in that bag? What does mom put in that for you? And not trying to be a detective snoop, but just to try to get an idea. And then ask, is pop a big part of this child's life? Are, bagged food, chips and Cheez-Its and stuff like that, is that a big thing? Or is that something that you try to talk positively about? How many fruits and vegetables are you doing? Do you like apples? How many times have we heard, if you're good at the doctors, we'll take you to fast food heaven? Well, maybe we can say, why don't you stop by and get them a nice apple or a little bag of carrots. If necessary, and you want to look at the BMI percentile plotted for age growth chart. And as we know, there are an awful lot of kids that are way over on their BMI. So we want to talk about not only nutrition, and then kind of sneak in there, are they getting much activity, or are they glued to the TV? And don't forget that laboratory tests are indicated. And then, of course, we should do vision screening. Medical screening history, risk factors. Was a child a preemie? Did they get oxygen? Make sure you do an easy for me to say, ophthalmoscope exam. 3 years and above, external observation, ophthalmoscope, and you should be able to do a basic visual acuity and some muscle test. If there's a potential visual problem, send them to the optometrist or to the ophthalmologist. Hearing screening. Review history for risk factors, preemies, symptoms that may be indicative of. Does a child answer to your calls? If you drop pots and pans, does a child startle? Observe the child. Question the parent for physical behaviors or speech development that may indicate a hearing impairment. 3 years or older, you can manually administer using some specified equipment. If it's not available, refer for pure tone testing that gives us objective value. If you think that there's a potential hearing problem, please refer to one of the children's hospitals or to the appropriate audiologist, because nothing will stop development like not being able to hear and interact in their world. Dental screening, extremely important. Birth through 2 years, you're going to talk about looking at the development of dentation, look for caries, talk about milk. Do you send the baby to bed with a milk bottle? All that sugar laying behind the teeth. And then 3 years and older, we should refer to a dentist. And there are a lot of good dentists, and we have an extensive dental network in the Buckeye system. Appropriate laboratory tests. Now this is interesting because I think all children need to be tested for lead toxicity. We used to say, well, maybe kids that are in poor neighborhoods or that, but all children between 12 and 24 months, or actually at 12 and 24 months. Children who are 3 to 6 years, if they haven't been tested, should be tested. Sickle cell, at least once for kids that are at risk. Hemoglobin and hematocrit is medically indicated for anemia, iron deficiency. If the baby's had a tremendous amount of milk-based diet, we all know the big healthy, oh, look at that big healthy kid, but maybe they've had milk and they've had the micro iron losses. So that's very important. Also, don't forget, there are an awful lot of preemies out there and low birth weight infants, so hemoglobin screening is important. As the young people get older, pap smears if they're sexually active, testing for STDs, tuberculin tests if they're at high risk or from foreign countries or have exposures, and other lab screenings that you've learned to do along the way. Treatment. There's a long list of treatment and Medicaid coverable services. We have at the end where you can go through a series of slides that I'm talking about, but it's so extensive I just don't want to go through and just go through every single thing. But I'll go through some of the more unusual things you wouldn't think of. Family planning services, EPSDT as we've been talking about here, health check, private duty nursing services. We have babies that sometimes have had heart surgery and they're on feedings throughout the night. We have children who sometimes go home on night ventilators, and they do have private duty nurses when that's available. Sometimes the mom needs some home health services to help bathe the children, to take care of them. Maybe they're twins that need. So it's not just, oh, go to the doctor's office, that's covered, but other things that we normally wouldn't think about can be covered in addition to physician and dental services. Treatment and Medicaid coverable service, again, another long list, but some of the more unusual ones, that case management services are available, and trying to encourage the parents to, you have a case manager at Buckeye if your child is at high risk or if there's a need, and they can help give you all different kinds of services. They can help with diabetic teaching, they can help with weight, they can help with so many things, and they're there not to be a snoop, not to get in the house, they're there to help. Personal care services, they can be the advocate for helping get the right things or directing them to what things. There are also, when necessary, psychiatric services available. So there are a long list of services that are available. Again, they're listed at the end, and you should be able to print those out. Treatment and follow-up care. It's very important when you have a screening service that indicates a problem, please get a further treatment referral without delay. That's mandated by the Ohio Administrative Code. And remember that evaluation, diagnosis, and treatment may be provided at the time of the health check screening visit if the health care professional is qualified to do it. If you can treat the services, do it. If you can draw the blood in your lab, please do it there. We don't have to send them off anywhere. So, treatment and follow-up care can be provided by primary care, our family physicians, pediatricians, OBGYNs, specialists, neurologists, ophthalmologists, audiologists, and then our other healthcare professionals, advanced practice nurses, psychologists, nutritionists, and probably most importantly can be some of our community agencies. So here we have health check, which is early. Let's start at the beginning. Periodic, make sure we're checking all along the way. Screening, we're looking for that. We got our radar out, so to speak, and when the radar hits a blip, let's make the diagnosis and let's put some treatment into play. If we do all of these things, the goal is healthier children who will use less health resources as they get older, will be more productive in terms of being successful in their education, as well as citizens in their mental health and in their This program can have a very